Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We are here today, me and Dr. Weiler.
Yes, we're missing our sidekick, Taylor.
Yep, we're missing our sidekick, Taylor. She is out doing the Lord's work, injecting all the people, but she'll be back next week for sure. Today, we are going to talk about something that I love. Okay, I love it.
Yes.
I'm a huge fan of it.
Can I say the title?
Yeah, go. Wait, say it.
Wait. Women need testosterone too?
Absolutely, they do. Yes, sir. I think everyone needs to know that females need testosterone just as much as males do. And to help me out on that, we have with us today Miss Lacey May. She is one of our nurse practitioners over at Rejuvime Medical. Thank you, ma'am, for joining us
lovely
here.
practitioners.
So excited to be here.
Okay, tell us a little bit about yourself.
So from Baton Rouge originally, and now live on the North Shore where, you know, the world is a beautiful place. It's perfect. And I've been into the anti-aging world for a little over 5 years now. I love it. I absolutely love it. Everything about it. I'm married, 2 boys that are just a lot to deal with. But other than that,
You need testosterone in your household just to even.
100%. Just 100%.
And from my perspective, I'd say you're probably one of our more advanced practitioners, right? Yeah. And I mean that in a good way, that you always you push the boundaries, you're seeking new things. I mean, this world is constantly evolving, right? I kind of feel like we're just on the cusp of the golden age, right?
Yes.
Yeah.
We've got these new GLP-1s, we've got all these peptides coming out.
Yes.
We got some really good stuff in the pipeline coming out for us that's really going to help us. So
Yes.
now the reason we have you here is because you are you push the envelope, which I
Yeah.
think people seek you out for.
Yeah.
You definitely have I don't want to call it a cult-like following, but Lacey you have some very dedicated patients, which is awesome. I mean, you've made a name for yourself and we love it. So I'm interested to get your take on this.
She's crazy enough, and she's interesting. No.
I like it. No, it's perfect.
Putting women towards the forefront.
Yeah.
Women are the forgotten. You know,
You're right.
We do all the things, and when we're young and beautiful and having the babies and doing all that, and it's the older we get, it's nobody talks about it.
No.
You sound like my wife. So I like
Nobody
that.
talks
You're right.
about
No,
it.
that's amazing.
It's so taboo. So it's bringing it forward and making women more aware so they know what questions to ask and what's available.
Be comfortable. Well, we're going to get into it today because I think this is definitely something that I know when I tell people I take testosterone, they're like, what do you mean?
Yeah.
Why do you need it? And I'm like,
it is still very taboo.
Yes.
Still very taboo for a female to take testosterone, which is crazy in my mind.
Wild.
Right? Yeah. Yeah.
Because I'm like, y'all aren't the only ones that can have fun stuff. We can have fun stuff too.
Right.
Exactly.
And I think testosterone is definitely one of those things. Okay, so Lace, let's hit it at the very beginning.
Yeah.
What is testosterone? Kind of give us a little rundown.
Yeah.
So testosterone is one of our major hormones in our body. Just as important, in my opinion, is estrogen and progesterone. And it's something women naturally produce by our ovaries, our adrenal glands. And of course, as we age, you're not going to produce as much as you did when you were young and vibrant at 16 and 20. So it's a hormone that is very important for overall well-being, your mood, mental clarity. Sex drive is probably, one of the biggest or loudest benefits of it, but also just energy.
Just energy.
Density.
Yeah. Energy.
Right. Just more gas. I always reference it like gas in the gas tank.
Yeah.
Just feeling
Not running
like
on E.
Exactly.
Yeah.
I'm not running on E.
Yeah.
It's crazy. So I have a young daughter, and I went to her high school. And I was telling Britt earlier, they take dance class, optional class. So they had their big review last night. And so there was probably 300 young ladies on the stage. And so there was like 1,000 people, and there were even some boys there. And the boys from the Catholic high school down the corner. And the energy in that room, and they had a finale where they all came on stage, and like the energy of a 15 through 18-year-old adolescent, you can just like feel it radiating, the joy, the energy. Like I'm saying, like you just can't replicate that, right? And that's like, you're not trying to be weird, that's hormonally driven, right? That's,
Absolutely.
I mean, that is like, it was like a bright light. Just they're all going nuts, and you could just, it was crazy. It was quite a scene. But,
well, it's so funny that you bring that up because, you know, I always tell people in my consults, whether it be a man or a woman, think of yourself from the age of, 16 up to like early 20s.
Yeah.
Think of the person you were, and they're like,
late 30s, some of us.
It's like how were you then? And they're like, oh, I was on top of the world.
Yeah.
You know, that's definitely hormone driven.
Wild.
So yeah, that's a good point.
So, okay. So females, testosterone. Obviously, we know that both females and males are producing this hormone. But why is it important for females to have testosterone?
Well, it's important just like, I always say if we had it when we were younger, obviously we do need it, right? So very important for females, not only from a physical standpoint, muscle mass. Love these GLP-1s, obsessed with them. I think they're fantastic. But one thing in women is the muscle mass situation. And I feel like every woman, when they are seeking a GLP-1, well, we need to preserve your muscle mass, your bone density as you're getting older. So it really plays a huge role for women there. And then, like I said, the fun aspect, right? I love my husband. I just don't want him anywhere near me.
Right.
Yeah.
And you're like, okay, well, that's not okay.
That's not normal.
Right.
That's not normal. That's so it is more than just sexually driven for women. It's definitely more just
And heart health
well-being.
as well.
Oh, absolutely.
That's
What about mentally brain fog and depression and things like that?
That's the problem with women, is that low testosterone, or I'm going to even say suboptimal testosterone, can often look like other conditions, depression, hyperthyroidism, or like where women are like, okay, I feel depressed, I'm anxious all of a sudden, and I'm having this brain fog, and everybody's like, oh, well, you might be depressed.
Right.
Yeah.
And it's like, here's an antidepressant, making the situation
making the situation so much worse.
Then the brain fog gets worse.
Then the brain fog.
So.
I think it has, I'm going to chime in, testosterone to me is like, it's drive. And what that means, it can be sex drive, it can be drive for life, drive for enjoyment, drive to live your life, right? And those are all, to me, like the spectrum of what I term as drive, right?
Yeah.
And so, I think drive is sort of like, society puts that on the males, unfortunately, right? Where, females need it too, right? Females have it also. And, I think it's, like you said, females run the world. I always say, like the medical community is driven by women, really. It's like the nursing, the aides, and, so women really drive the world. And I think it's been a disservice that we've done as a medical providers, as a community, to just assume that loss of drive is depression.
Yes.
Right? Not
Absolutely.
sort of lack of hormone.
Well, it's always, like when you go to someone like you said, tell them the symptoms. Hey, I'm tired. I have brain fog. I don't want to do anything. I don't have any drive. No one's like, oh, you know what? Let me check your testosterone.
Right.
Absolutely.
Like that's not how it's being dealt with on, like your PCP side of things. You're running an annual panel and it's like, well, you're fine.
Right. And a lot of these treatments they're giving are Band-Aids for what the underlying issue is, so.
And like you said, sometimes making it worse.
Oh, absolutely.
And so I think that, once again, we are women, we are strong, we need to be heard.
And hopefully
I'm outnumbered on here, guys.
Just saying. Well,
hopefully it's getting better.
Testosterone got you where you are today. So that's what, But okay, so what are these? I know you see females all the time that come into the clinic and, they're just like, hey, Lace, this is what's going on. Like, help me. What are these girls telling you? What are these women coming in and saying, like, this is what's going on, and how are you like, you know what?
Right.
This is what we need to do.
So one of the main things is that that get up and go. Women, I used to have this get up and go, this drive to whether it be work out or take the kids to the park. Maybe something simple as that. I don't want to do anything. I'm not depressed. I just don't feel like doing anything. All of a sudden they're having, I'm feeling anxious. I'm not an anxious person. I don't want to take anything that's going to, numb me or kind of, make me more tired or less motivated. So it's all of those things. I love my husband, boo-hooing, but my marriage is in shambles. I don't want him anywhere near me. I don't know why. Exactly.
No,
exactly. And then the women are trying to make the necessary steps. They're trying to go to the gym. They're trying to lose weight, and nothing's happening.
Right.
Nothing's happening.
Right.
They're like, how are these women getting muscle mass and they look fantastic?
losing the weight, losing,
Exactly.
and it's just nothing.
Right. So that right there demotivates you because you're like, well, why even go?
We live in a world with social media and with others that we compare ourselves constantly, right? Like, I'm eating healthy. I'm eating a 1,600 calorie diet. I'm working out, 3 days, 4 days a week. And I'm not getting anywhere.
Yeah.
I see and hear that all the time.
Yep.
Yeah.
And it's because, you're driving a car on empty.
Yep.
Right.
And I think that's a huge thing that happens. When do you see, so in your practice, what is sort of your primary age that you see this problem sort of start to develop? Or is there even a primary age? And like, what do most ladies come in with? And I guess you just ran through the complaint, so that's a rhetorical question, but what's the age where you kind of see this starting to happen?
Normally it's around, most of the time, women, 40s, 50s, but it is getting younger and younger, which I love, because these women are going to be so much more prepared, right, going into the perimenopause world,
educated,
and all of that. They're absolutely,
they're going to be so much more educated the
so
more that we're
educated.
talking about this.
And I'm even seeing women in early 20s. There really is no perfect age. Like I said, it's more about what are their goals, what are they trying to achieve, and what tools can we give them moving forward. And now they're seeking testosterone replacement, which is so nice because there is more conversation around it now than there was before. So it could be anywhere. And gosh, even up to 70s, which yay. Love
get
that
it, girl.
for them.
Yeah.
Get it,
Just
girl.
because you're older doesn't mean that, you have to accept that.
Yeah.
So it could be all over the map.
Talk to me about the stigma associated. Why do you think it's there? Is it breaking down?
Do we have enough time?
That's a good,
Because it's not fair.
right.
And, I'm not going to be one of those bitter women, but there is so much lack of information, clinical trials, research done on testosterone replacement. I'm going to rephrase that, hormone replacement in general in women. It has been historically geared towards men's hormones. And, of course, anything that's been done as far as research or clinical trials on women's hormones have been very incorrect in the past. So it's really lack of knowledge. I know all the schooling that I've gotten, I never even knew, what role testosterone.
Never even touched it.
Do you know what I think? You know what I think a big part of it is, squeaky wheel gets the grease, right? If you have a guy who cannot have an erection or something like that, they're going to be, somebody help me like immediately. And I feel like girls in the past, you just take it. It is what it is. It was just like quiet. You age gracefully.
Well, and I think especially like the whole menopause thing was, society sort of, a woman that was no longer, you're going to get mad at me for this, but I think it was almost termed like no longer useful. Like a woman that couldn't reproduce.
Like, choose your words wisely.
Yes.
But a
be
woman,
very careful.
But you know what I'm saying? But like, if you look back, like a woman that was like, hey, society, used to look at a woman and say, hey, her primary purpose here is to have kids, right? And a man's primary purpose is to, feed and support and, protect, right? And so unfortunately what happens is a man can continue to do that for, for his life for the most part. But a woman, unfortunately, there's a definite, no, we can no longer reproduce. And I think that point, those women were almost forgotten,
Yeah.
you know, and,
Yeah,
and sort of
absolutely.
pushed to the side. And this is your second stage of life where you're not allowed to be happy. You're not allowed to have a relationship or be sexual. You're not allowed to fulfill your dreams. Now you're in a support role only, right?
Which is crazy because you've raised your babies.
Right.
Your marriage is stable. You're
Yep.
more successful in your career, and
Yep.
it's like, okay, now I have to accept I have this brain fog, and I have to accept I don't have the energy to do anything with my husband, and
Right.
you know, it's the time of women's life where they need more support.
I agree.
Rather
and
than-
it's strange. I was watching Shogun, and have you all watched Shogun?
No.
So it's an interesting show, but anyway, so it's all about how the emperor or the guy that, you know, the king, whatever you want to call it in Japan, is allowed to, if his wife can no longer reproduce, she's moved on into a different phase, and he's allowed to take a new wife.
Oh, lovely.
Yeah, and it was just sort of hit me
Good
that,
for
like,
him.
you know what I'm saying? But like, it's the whole mentality, and things are a whole lot better. Obviously, this is
yeah.
12th century Japan
Yeah.
we're talking about,
Yeah.
you know, where people are dying of scurvy,
Yeah.
and so, you know, life is a whole lot better. But I'll be honest, I don't think there was even a significant change, and probably not until like the 50s and 60s,
Yeah.
where we
No.
started to evolve into this. And then, like you said, medicine has sort of ignored the postmenopausal woman in terms of hormones. And so, you know, really, I mean, it's still, I know testosterone is still a very taboo subject. Now, hormone replacement, estrogen and progesterone, you know, it's crazy how we say hormone replacement in females. Everybody just thinks estrogen, progesterone.
That's it. Female.
Exactly.
No one even
There's so
mentions
much focus on it.
testosterone, right?
Yeah.
Right.
Oh, no. You know, and it's always like, hey, you know, every 3 years a new study comes out, you know, hormone replacement for women causes cancer, it doesn't cause cancer. Well, the only thing they're talking about is estrogens and progesterones. They're not even talking about testosterone.
No one ever talks
So it's not
about
even
it.
really in the conversation from women. And so I think, you know, places like Rejuvime, practitioners like you that are like pushing it is amazing. And I mean, a taboo is so deep in my mind, you know. I know OBGYN friends, you know, that they'll do hormone replacement, but for them, that only means estrogens. They're
Right.
never going to touch testosterone.
No.
Right.
No.
And, you know, that's half of the equation, right?
Absolutely.
And it's crazy. But anyway, I'm getting off on Shogun here.
No,
I mean,
it's a
it's
good
a-
point, and it's coming a long way, but we're still not
Oh,
anywhere
yeah.
close to
Yeah,
where
I mean, still
we
look.
really need to.
Yeah,
be.
I know we have patients that we treat, females, and we're treating them fully, right? And they may roll into their OB's office or roll into their PCP office, and they'll give them the list of medications that we've got them on, and the OB, depending on their politeness, may or may not say anything about
Yeah.
what we're doing, right? They'll
Yeah.
raise their eyebrows and like, you're giving you testosterone. Like, really? That's crazy. You know?
Right.
No, it's
crazy.
not. No, it's not
crazy.
No,
you
it's
know?
not.
Yeah.
It's absolutely normal.
And they've taken happens. I'm telling y'all so many times where patients they'll freak them out, you know. And they're
yeah.
like, you
Oh,
need to get off of this, and
Yeah.
Stop
women
it.
do, and they come back in a month. I feel horrible.
Right.
I felt so good. Why are they taking me out? And I'm like, I
Lack
can't
of
even tell you.
education.
Ignorance.
Lack of
It's
Ignorance
lack of
and
ed-
fear.
It's
Exactly.
It's
lack
fear
of
of what you
education.
don't know.
Yep.
It's ignorance of, you know, doing the research and looking at it from a different perspective. And it's, you know, just accepting what people accepted before. I
Yeah.
always use the example. I mean, medicine moves so rapidly. We used to take x-rays of pregnant ladies for the fetal position in the 50s and 60s. X-rays.
Yeah.
You know, I mean, that's insane.
Yeah.
You know, like,
Yeah.
And
Now-
that was like, oh, you got to get your x-ray because we need to know where your baby is.
Yeah.
You know, like,
Now we're in full lead gowns to be even
Right.
in the room, and that's like not at all. That's wild. Okay, so tell me, so a patient comes to you, a female. Y'all have decided that we're going to start you on testosterone therapy. Tell, what are the different types of testosterone
different types.
therapy?
Walk us through the process.
Yeah, like walk us through.
Okay.
you know.
So when women come in, obviously we're going to do lab work and we're going to look at lab work, but the comprehensive history, physical, what medications are you on, just kind of getting a full picture. What symptoms are you having? You know, what's going on? What goals? Goals are probably one of the first and foremost things I like to address because every woman's very different.
Yes.
But we do all this. We talk about it. There are many different ways of administration of testosterone in females. We have a lot more options, in my opinion, than men do. But one is a cream, something, that you can apply topically to the skin. That is probably the easiest. Just kind of dip your foot.
The gateway testosterone.
Gateway.
And is that daily? Is it weekly?
It's daily.
Okay.
So the beauty of a cream or anything topical is obviously it's easy to apply.
Yeah.
So application is pretty easy. And it kind of gives us that little bit of steady absorption daily. So not as many peaks and valleys and all of that. So women tend to feel pretty stable on creams. Downside to creams is they're just they can get messy.
A little messy, right?
Yeah.
You can transfer creams to other people.
Yeah.
So anybody with kids, even animals, think about your pets.
Yeah.
Not a great option there. Injectable testosterone is probably my favorite. The reason I do like that one is because I'm not going to do something every day. Let's be honest.
Yeah.
Yep.
And it's usually once. Sometimes maybe we'll do twice a week. Sometimes women will like higher doses. We may go to every other week. There's many different ways that you can do it, but you get more of that immediate absorption and immediate benefit. A little bit more peaks and valleys, though, so we do have to take that into consideration. And then the other is pellets. Pellets are getting a lot of hype right now, which I love. They're fantastic for women.
Yes.
They're
Talk
a
about
little,
not doing something once a day or once a week.
absolutely.
This is
That's the
the
way.
set it and
easiest
forget
form.
it.
Yep.
Absolutely. But it looks like a little, almost like a little Tic Tac that you just make, you put into the hip, upper buttock area, and a woman absorbs that over about a 3-month span. So it's really nice. It's really easy. It just depends on what they're going to be compliant with, really.
So a lot of different options.
Tons
Of options. That's what it's like. It's not a one size fits all. I mean, you may start on the injectable side of things and then say, hey, I love this. This is good, but I can't remember it. So let's go to
I encourage
pellets.
women to change it.
Yeah.
Even if you love it.
Change it up.
Because you never know what you don't
You haven't tried.
You don't know what you don't know.
You don't know what you don't know.
You don't know what you don't
made
know.
reference to different levels. So I think it's interesting. I do think different people need different levels. My wife, and she's going to kill me but she, so obviously we're older and we do, obviously, I'm the founder of the company, so we do hormone replacement, right? And so just sort of a few weeks ago, we were talking and she just happened to mention that, when I used to go, because she was a nurse, when I used to go for my physical, my physician, my doctor always mentioned, wow, your testosterone's really high. And this was before we ever started. So, and I do notice that she is in a much better mood with a higher testosterone, which is kind of crazy. That I do think some women run. I mean, I've seen women. I had an employee for a while she was an awesome employee, and she came in. And she went and got her. She was in late 20s, and I don't know why she ended up getting her testosterone was like 250 naturally,
Good for her.
275, which is
Love
crazy.
that
And she
for
was an
her.
awesome
Good for her.
salesperson. Yeah,
She
And
was a happy
She
girl.
was a
Yeah,
happy
I
girl.
tell
She
ya.
was awesome.
Right.
But I do think that there's different levels for all different ladies.
Yes.
And I'm kind of get off track, but tell us about. All right, so a lady comes in, you discuss the options. Tell us about like expecting like when does treatment kind of kick in? When do you reevaluate? What are your parameters for these ladies? Kind of take us through a process a little bit.
So it depends on the route of administration, but normally I'll say within about 4 weeks or so. I always like to tell patients, keep like a little track. Make a note on your phone where, okay, I really noticed my mental clarity good today, or my sex drive has been off the charts.
Right.
That way we kind of know where we're going as far as dosage goes. But I always say within a few weeks, maybe that'd be about 3 to 4 weeks. Now, long term, that's where you're going to see more of the more muscle mass.
Yes.
I'm going to start to see I'm a little bit more toned than I have been before.
You're going to see the results from working out, right?
Yes,
You're hitting that
absolutely.
gym and
You're
you're
stronger.
Stronger.
Yep.
You're going to develop a better physique. You're not going to turn into a man, right? You're not going to turn into
No.
Arnold Schwarzenegger by any stretch of the
No.
imagination.
I always make the joke when women ask about that. I'm like, I would die if you called me and told me I'm growing a beard or whatever. I would be mortified. I will not let that happen.
Right.
But that's why in women, obviously, we don't need men doses.
Right.
So it's dainty. I call it dainty
Yep.
little doses where every woman, it can go anywhere where a woman is at 60 and she feels like $1 million. And some women do need to be,
Yeah.
you know, I have some patients that
In the
do need
hundreds
to
and the low
be in the
200s, yep.
200s because she runs 70
Yeah.
miles a week,
Yep.
you know?
Yeah.
So it's just very, very individualized, but it's important for women to know that it's the teetering, you know, messing with the dose. We have to do some adjustments to find where you feel the best, but it's a fun ride because they really start to see, or mostly they say, I start to really feel like myself again.
Right.
Yeah.
I'm not just on the couch. I'm a lot more interested in things, and I think it's a domino effect. If you're more active and you feel better and you're losing weight and you're having sex with your husband, well, obviously you're going to be in a better mood.
Yep.
You know, so
More confidence, you're going to feel better. You're
yes.
going to have more energy. Absolutely.
Yeah.
Absolutely. It is a domino effect. So,
Yeah.
patients, what are some of the issues or side effects? What do you have to be careful for with it? Because every medicine, everything we put in our body, whether it's Tylenol, whether it's Advil, or whether it's
got a little
chemotherapy, it
Yep.
all has issues,
it all
right?
has a side effect. Yep. It could be very dose dependent. It could be very individualized. But I always tell women, keep an eye on your skin. I don't care how good I'm feeling. If my hair's falling out, I'm growing a beard, I'm not happy. But tend to a little bit more oil production in the skin. So women might notice that they're breaking out or having acne. Usually it's not facial. It's usually more body where they're like, oh, after the gym, you know, I'm noticing more pimples on my back. That's something that we have to look at. I always say hair shedding. Testosterone promotes hair growth. But if the levels are higher than this individual person needs, sometimes women might notice they're thinning a little bit. So that's something to keep an eye out for. But increased body hair. So, you know, where they might feel like, okay, my little peach fuzz, I'm having to dermaplane a little bit more.
Yeah.
But other than that, women are not supposed to have, you know, the higher blood counts like men do. We're not doing those doses.
Doing those
Yeah.
doses.
So it's a lot more, you know,
More
safety profile is
yeah.
definitely there
Yeah.
with
Safety's
testosterone.
excellent. Maybe a little more. You could have some subtle effects. You know, I would say nothing that, you know, you didn't deal with in your 20s.
Right.
Yeah.
Right. You know,
Yeah.
I mean, you know,
You're just bringing it back.
Yeah, you just bring it back.
You're
So,
just
you know,
moving
it's
that
rare,
time
but you
back.
can have a little bit of an acne. But there's medications and issues things that we can do for that.
Absolutely.
Yeah.
So
Absolutely.
I think
Exfoliating, facial wash,
Yep.
like all kinds of stuff.
Oh,
that
there's
really
some
helps
women.
Out.
They're like, I'm like, do you want to lower your testosterone? They're like,
hell
no,
no.
I'll
No,
laser.
no,
I'll
no,
laser.
no. I have an
You know?
appointment. Thank
So,
you.
Appreciate that.
No. All
Well,
right.
look, I think that was let's do this. We're gonna take a little break, right?
Yes.
And then we'll come back and we're gonna play Britt.
Yes, I
is
will be
gonna
the patient this
our
week.
patient, right?
So much fun.
Yeah, it's going to be
Really?
amazing. So I'd like to thank our sponsors. As always, Rejuvime Medical, Louisiana's largest anti-aging clinic. They specialize in GLP-1s, hormone optimization and replacements. We also do aesthetics. And also Weiler Plastic Surgery Group, Louisiana's largest aesthetic plastic surgery group. We got 5 aesthetic plastic surgeons in the group. We also have over 12 injectors, multiple locations. So stay tuned. We're going to come back with Britt, and we're going to continue this awesome discussion.
Yes.
My name is Felicia Ferranti. I'm from Mandeville, Louisiana, and I had a breast augmentation. For me, I knew that I wanted to go natural. I knew what I was looking for. I remember finding Weiler's website, and I was like, this looks really natural. This is exactly what I'm looking for. Having my clothes fit is a life changer. Seriously, just nothing ever fit my shoulders, nothing ever stayed on me properly. That's all I ever wanted to do was just fill out my clothing, and that in itself, literally a dream come true. I know that sounds dramatic sometimes, but seriously, it is a dream come true.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. You know, the college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
All right, everyone, welcome back. Now it is we're going to get into it from
We're gonna
a
switch
patient.
roles here,
We're gonna
right?
switch roles real quick. I've never been the patient here. I know Taylor and Dr. Weiler have in the
Yep.
past, but I am absolutely getting into it. So my name is Brittany. I work at Rejuvime. I'm a nurse by trade. I do all kinds of fun stuff. We've been in this realm
Put
for
you in the
quite some
confessional,
time.
hey?
I know. But I will say, so like I didn't know anything about hormones. I came from 15 years ICU prior to starting to work at Rejuvime, and they don't teach you this stuff in nursing school, and
No.
it's not like a thing that's talked about. And so even once getting into it and learning all of it, it's so enlightening. And I will say, like, my testosterone journey started when I was 30. I was 33.
Okay.
I was 33. I just had my second child, and this was months after I had my youngest daughter, Ellie, and I wasn't picking back up. Like, I wasn't picking up. Like, we talked, a week or so ago, is after that first kid,
Right.
it's okay.
Yep.
After the second kid, it's like, okay, I'm not picking
Second
back
kid
up.
is tough.
Yeah.
That second kid will get you.
Yep.
The game's changing after that second
yeah.
kid.
Yep. Physically, mentally, everything.
Everything.
changes. Yep.
And I just
Yep.
felt that I was like, I just can't get it together. I'm like, I don't know what's wrong. And of
This was a few
course,
months after delivery?
This was about, this was probably about, because I had stopped breastfeeding. I breastfed for 6 months. This is probably around like month 6 to 8.
Okay.
And so like I had stopped everything. So I was
Still a lot of hormone surging with breastfeeding, right?
Yes.
That's a
Still- and
hormonally
so-
driven activity.
I was thinking, I was like, once I stop breastfeeding, maybe that's what it is. I'm just drained. I'm trying to keep up. I was like, so then I waited a couple months after that. And then I just started thinking, I'm like, am I depressed? I was like, do I have postpartum depression? Can you have postpartum depression 8 months out? Like, I don't know. But I just couldn't get it. I didn't have any. When I got home from work, I wanted to take off my scrubs. I didn't want to bathe. I just wanted to put on regular, and I just wanted to fall on the sofa. That's all I wanted to do.
Yeah.
And I'm like, if Josh would have touched me, I would have broken his arms off immediately.
Get off of me. Yeah.
Like 1,000%, because I was
Yeah.
so tired.
Yeah.
And I was like, okay, this is not right. So at work, like I said, I was fortunate enough to be working in this realm
Right.
at the time, which was fantastic. I went to work. I was like, hey, listen, this is what I'm feeling. I talked to our nurse practitioner. I was like, this is what I'm feeling like. She was like, obviously, you've been on a hormone roller coaster over the past, because I was pregnant, been breastfeeding for like 3 years
Right.
straight. She was like, let's take a look at your labs. Let's go ahead and take a look at labs. I'd already started back. I had a regular cycle. So I was like, all right, let's take a look at it. My testosterone level, if you had to guess, what would you think it was?
Less than 3.
It was less than 3. My
Ding, ding, ding.
testosterone was not detectable
Wow.
on a lab test. And when I saw that, of course, I had seen this on all of our patients'
Right,
labs
right.
and stuff, but I was like, oh my gosh.
Yeah, I mean, your fuel tank was empty.
And we were out of fumes
Yeah.
at that time.
Yeah.
We
Didn't
were
even
rolling-
register.
We were
Didn't even give you a
rolling
2.
we were rolling into the gas station. So at that time, the route that we had decided on was injectables, and so I started with a very low dose of 5 milligrams of testosterone, and that's kind of where I started. Obviously, I've increased since then, just because we kind of played around with the doses and whatnot. And it probably took me.
Yeah, how long did it take you?
I was about to say, it probably took me closer. I kind of like felt it, but for it to consistently feel it, it probably took me about 6 to 8 weeks to kind of feel that like up, like
Right.
getting that
Get back
ump
to where
back.
you felt
Yes.
you should be.
But the way that I didn't want to fall asleep. I wanted to play with the kids when I got home from work. I wanted to cook supper, have things, go places. Because what's wild is in my marriage, I'm the social calendar gal, and Josh is not. And so at that point, I was like, I had turned into being just like, no, I don't want to go.
Right.
Like, I don't want to go. And
Right.
so then I started picking back up, wanting to go back and do things. Not wanting to break Josh's arms immediately, like if he were to touch me, stuff like that. And it was just, you don't realize how bad it is until you see it on the other side.
Right.
Right.
And it was wild.
Right.
And I absolutely love. I mean, I am such an advocate for this. Now, when people ask me, they're like, "Oh, do you do, I see y'all do testosterone for women. Do you do that?" I'm like,
Right.
"Absolutely, I do, and everyone should.
Yes.
Right.
Yes.
Everyone should."
Yes. Yeah.
Lacey, do you feel
Sorry.
like that's kind of typical sort of presentation, or
Yes,
Okay.
100%. 100%. I say I could speak from experience because, when I had my second baby, and I knew nothing
Right.
about all this,
Right.
that I felt the same way. My husband I would get home and he would be like, and I was always a get up and go,
Right.
whether I'm going run or going to the gym. And he would say, let's take the kids to eat pizza. And I'm like, don't want to go.
Right.
And he's like, are you depressed? What's going on?
Right.
And then I had my levels ran and I felt that way too. And it really got to a point where I don't ever tell women to focus on a number. A number just
Right.
means absolutely nothing. But we do monitor it, every few
And
weeks.
when you say number, you mean like the level of the
The
testosterone.
level,
Right.
your testosterone level, because even if you were at 25, you could still be fully symptomatic.
Yeah.
It's just, I use the word testosterone replacement as more men because we're replacing, right? But women, I always say we're essentially restoring your testosterone to where it needs to be for you to feel good.
Yeah.
It's not so much about a number. It's all about the symptoms.
Yeah.
And then, you play with it. You mess around with it to where you find out, okay, I feel really good at this level, at this dose. I'm not having limited to no side effects. Did you have any side effects?
I did not, which I think, my skin is dry.
Right.
My skin's kind of on the drier side of things to start with. So I didn't have like any increased oil production or anything like that. I would have liked to increase oil production.
Right.
But I didn't really have anything. But I didn't have any like increased hair growth, but I'm not like, I don't have like dark.
You're like a like a hairless chihuahua.
Yeah.
You're like a hairless
Like those
person.
cats, they're
You're fair skinned, you don't have a
So like I didn't have like a lot of I didn't have anything like that. But I will say I'm fortunate enough to have an amazing OBGYN. And I told him that I was on testosterone and he was like, good for you.
Oh,
That's awesome, really.
He was like,
Oh, wow.
good for you. He was
Good.
like, I think this is overlooked a lot.
Yeah.
So it's like every now and then you'll get that
Yep.
good buy-in with
And
that
we are
OBGYN.
getting more. We
Yes.
absolutely, we have some GYNs in the New Orleans area that will refer to me and at least give women the peace of mind to say, hey, I support
Right.
it. I'm not going
Yeah.
to prescribe it because
Right.
I may not know
Yes,
how to adjust it, but they support it and and they'll refer to us and
Go to
that
the
makes-
specialist.
Yes, that makes me feel great because it's almost like a partnership.
Yeah.
Right.
With your GYN, which I love. I love to do that, but at least not making the patient feel like they're insane or
Well, and I also feel like because this is all that we do at Rejuvime, it's very focused and it is a very time consuming process because that is a relationship
Well,
that
especially I think especially with a woman.
Yes.
It's a more complex than men. By inherent nature, are simpler, right?
Yeah.
I mean,
Yes.
you
Yeah.
said,
Yes.
a
Bless
man
it. Right.
increases testosterone, check. Does a man get an erection? Check. All right,
Yes.
man happy, check,
Yes.
right?
Yes.
And so women are much more complex, and it's way more labor intensive, like you said.
and continuing to change.
Correct.
So obviously, when we get started on these medicines and stuff like that, we're just starting to change.
Yeah.
Right.
Like we're just getting into it,
'cause,
and
I mean, look,
everything's
30
about to go wild.
For a woman,
Right.
30 to 55 is like a roller coaster, right? Men, it's more of just a straight decline,
Yeah.
right?
Yeah.
I mean, men don't get surges in testosterone in their 40s,
Yeah.
It's different than ladies,
Yeah.
that are, perimenopausal, menopausal, having men, not having, it's
Yeah.
back and forth.
Yeah.
So it is,
all
like you
over.
said, it's much more labor intensive. And the current medical system is not really set up to handle that, and nor maybe should it, or this, and that's where we come in, and that's where practitioners like Lacey come in to really sit down and have that dialogue.
Yeah,
because
it does. It takes it. There's a lot of back and forth. There is, and we always talk about how these are vulnerable things that we're talking and trying to fix. Yeah. And so being able to have a relationship with someone who specializes specifically in this is so amazing.
And to not make you feel nuts. You already feel crazy as it is, and you have all these things going on, and it's like nobody's really there to educate you or pinpoint, hey, let's try this. This may not help everything, but it's going to get us started.
Yeah.
And like you said, being so complex, well, your estrogen matters, your progesterone matters, your thyroid matters. So it's really looking at women from a full.
Yeah, the whole picture.
Absolutely. You got to look at the full picture because all these hormones work together. And you, obviously, if you're 20 and everything's perfect and, you might need just a little testosterone. Yeah. But as women age, we do have to kind of pull some things in to make sure we're giving you the full benefit and that you're optimal everywhere.
Right. Yeah. Because we always talk about like having to be in balance. Everything is in balance. Well, if we're just replacing estrogen and progesterone, we're totally forgetting somebody over here on the seesaw that's just by himself. Like, we want that person to come play as well.
Absolutely.
So I'm
just sitting here. Women have a rough life.
Yes, we do. We have to have the periods and the babies and the menopause and all these things.
There's a lot of demands. We were, I operate and obviously multiple times a week. And so we're all sitting in a room and, all doing something, but you kind of sit around and talk. And so somehow we got on the topic. I've worked with mostly ladies like, if you had to come back, Dr. Weiler, would you want to be a man or a woman? They were going around the room, and invariably everybody was like, I want to come back as a man.
Man, like 100%, like 1,000.
My wife says that all the time.
100%.
If I come back, I'm coming back as a man.
1,000%.
It's just tough.
I just want
to
see.
The demands, and I think it's only getting worse, especially for women with, social media, with what you see, the expectations, the careers.
Well, that's what you have to be a career lady. You have to, set an example for your children. And you have to be the career gal, but you also have to be the mom that's also present in every single
that home makes activity. All the snacks and the meals, and then you got better be hot for your husband and have sex with him.
So my brother-in-law says,
get out of here.
He's funny. So my sister and my brother-in-law are both dentists, right? And so they share a practice, and my brother-in-law is always like, tells my sister, he's like, all right, so, you can't be the world's best dentist, the world's best wife, and the world's best mom. It ain't happening.
Damn it, let me show you.
He's always like, so which one today is going to falter?
Yeah.
It's usually the world's best wife, But it's the truth, without the expectations, you can't do it all. I mean, and it's just a lot, so it is. So it's you guys are making me.
Exactly.
Yeah.
It's a lot.
Thank you. You should. All right, Mother's Day.
You should absolutely feel that way.
Yeah, I'm like Mother's Day coming up, so everybody know that we're going through it.
That's why Mother's Day is such a big holiday in bands.
Exactly.
Father's Day is like, who cares?
That's all right. It's all right. But I mean, no, I think, and I definitely think that we're kind of shifting our mindset to this. The older we get, once our kids are, once our kids grow up and stuff, we're like, oh, this is our time to shine.
I agree.
We're coming in.
Absolutely. That's why I'm like, we need to
hot.
focus on women as we get older. And,
Yes.
Which was, like I said, I was so happy to see that Halle Berry went to the Capitol to promote, research on menopause. Nobody will even talk about menopause. Right. And Oprah's talking about it. So I love that. I love we're putting more awareness there, but
we're not just depressed. We're not just depressed
and crazy.
Well, because that's what I'm thinking. Like when you go back and when you look in the 50s and all this kind of stuff, when everybody was just like, "You're depressed."
Yeah.
Oh yeah.
Here.
Yeah. Here. Take your sertraline. Take your
exactly.
Stuff
You're depressed.
Right. And nothing against those medications.
No. But
they have their purpose.
That's just that was the standard of medicine at that point. It was just like, you're depressed. This is what it is. When now that we're becoming a lot more educated and we're doing a lot more of this, forefront, cutting edge medicine. It's like, wait a second.
Yes.
No, we're just giving our bodies what they were meant to do.
Absolutely.
And so it's like, let's do it.
Yeah. The fact that, you can go to your gynecologist and, that they can't even say the word menopause or even talk to a woman about vaginal dryness. It's like, well, wait,
Right.
where did we miss the boat
Yeah.
here? And, you know, the more women that are talking about it, women are feeling a lot more comfortable, coming forward.
When we were talking about, we did a show on estrogen dominance, and Taylor made a good point. She was like, in our group text, everybody's like, wait, like I have all these symptoms. Do you have these symptoms too?
Yeah.
So it's like we know that every girl group out there has some form of group text message that we're talking about it. We every Wednesday, I drop my kids off at dance. All the moms, we all leave and we all go grab a drink while they're, at dance, and we all hang out. It comes up at least once a month.
Yeah.
On like signs and
Don't
symptoms. I'm like,
gatekeep. Don't be one of those girls. You need to bring forward, the benefits of the testosterone and what it's doing for you and all of that. And sometimes when women see a true patient, when I'm like, oh, I'm on testosterone too, they're like,
Right.
oh,
Well,
but you look like a girl. And I'm like,
where's your beard?
It's like all
Like,
the things, but it's where it makes them feel a little bit more
comfortable,
like a human. Like, okay, I am getting older. I do need to address these things, and that there are things that I could actually do about it. I'm not going to have to just sit here and, like you said, just kind of accept it. Accept it.
Not anymore. We're not accepting things anymore.
So, Lacey, anything we didn't talk about? I know you came with a fabulous list of notes. Anything that you wanted
Which I didn't even look at.
That's okay. But
Because you're so knowledgeable.
No,
you are the expert.
Anything that you wanted to tell our audience to
do it.
I mean, just pretty much what we've touched on. I always make the joke about, and all my patients will know this joke, is that 100% of women will go through menopause and have 100%.
You're right.
Yep.
5% of men have erectile dysfunction. And what is like one of the most overprescribed medications is Cialis and Viagra and all that, but yet women's health gets nothing. And it is something that I do think women need to advocate for themselves. Talk to your doctors about testosterone, your estrogen, and if they are not willing to have the conversation or listen to your symptoms, to get with a hormone specialist. Have your labs looked at. At least go have the conversation.
Yeah.
Think about it. Do your research. And, it's worth, as you get older, for you to put yourself first. So.
Yeah.
I love it. I'm here for it. We're all advocates for it because we know exactly how fantastic it is. Okay, Lace, thank you so much for joining us.
Thank you so much for having me. This was so fun.
I know, thank you. Y'all, thank y'all for listening. Make sure to like and subscribe. All
Subscribe
those things.
below.
Make sure you're listening to us on Apple, Spotify, YouTube, all that stuff.
Yep.
Always remember to stay curious, stay informed, and to always consult before you cut. See you guys next week.
Thanks, guys.